Namaskar, I am Dr. Jitendra Guru. I am trying to make videos in medical subjects using simple languages so that general public can understand and take advantage of these videos. Today I am talking about diabetes. In diabetes, we should know about carbohydrate. Food items which when taken will increases our blood sugar will be included in carbohydrate. Example, sugar, potato, any underground root items, sweets, rice, etc. Diabetes happens when our body loses or has reduced capacity to digest carbohydrate. And when the carbohydrate is taken, the blood sugar rises very high. In empty stomach, if the blood sugar is less than 100 milligram per deciliter, it's normal. If it is more than 100, less than 126, it is pre-diabetes, that is you're going towards diabetes. Is equal to or more than 126 is diabetes. If we take blood sugar at 2 hours after taking food, the value less than 140 is normal. 140 to 199 is pre-diabetes and is equal to or more than 200 is diabetes. So about pre-diabetes, I have made a second video, how to diagnose pre-diabetes, how to treat pre-diabetes, and how to be cured of pre-diabetes. You can see in my second video. But today let us talk how to diagnose diabetes or pre-diabetes early. So to diagnose pre-diabetes or diabetes early, we have to do blood sugar test. It should be at least once in 1 year. My suggestion is that you should at least do fasting and blood sugar after food at least once in 6 months. In that way, we will be able to diagnose pre-diabetes or diabetes at the earliest stage. So what will be the advantage of diagnosis this disease early? In pre-diabetes, we might be able to cure the disease. And in diabetes also, I would like to say that it is very possible to cure the disease if we are diagnosing at the early stage where the person does not have any complications. Now let's talk about diabetes. If a person is diagnosed with diabetes, what can he himself do? One is he should decrease his carbohydrate consumption as less as possible. In carbohydrate, the underground items I have told, among them radish, little bit of carrot, garlic, ginger, onion you can take. Rest other underground items you should leave. Exercise. You can do exercise 30 minutes a day. Exercise includes walking, running, swimming, cycling. Whichever exercise suits you, you can do it. But it should be done at least for 30 minutes. Once you start walking, you should not stop before 15 minutes. That means you start walking, you walk for 15 minutes, then you rest, then walk back 15 minutes. So how much to walk? If you are walking and you are very breathless, you cannot talk, then you are walking very fast. If you are walking, you are still singing and talking nicely with your friends, that means you are walking very slow. So your walking should be in between these two. Cigarette smoking, chewing tobacco, alcohol should be reduced to the minimum, or if possible you should leave it. Oil. A person can consume in a month only 500 ml of total oil. Salt. A person can consume in a day only 2.4 grams of salt. So how much is 2.4 grams of salt? For just knowing the amount, you can go to the nearby shop and measure 2.4 grams of salt and see for your own understanding, this is the 2.4 grams of salt. In chronic diseases like diabetes, hypertension, thyroid problem, usually we take advice from our friends, we talk to them. Most of the time friends give us good advice. But some of the friends might give advices which they have also not verified. They have just heard from somebody else, and it might not be true. So whenever information is doubtful to you, you should ask that information from a doctor. Doctor will be able to help you to verify whether the information is correct or not. Now coming to the point where you want to start anti-diabetes drugs. There should not be any doubt about the matter that the anti-diabetic treatment or medication should be started by doctor. And why is it so? Anti-diabetic drugs are made for different purposes. A person having only diabetes, a person having diabetes with hypertension, a person having diabetes with kidney problem, a diabetic with a heart problem. These people will get different kind of diabetes medicine. Using different kind of diabetes medicine in different group of people might cause increased side effects too. And moreover, sometimes you might feel that I am getting side effects of a diabetic drug. You can confirm that with your doctor. The doctor will be able to explain to you whether it's really a side effect and what he thinks is appropriate to do next, or it might sometimes be just a psychological effect of the drug to the patient. So doctor will be able to explain you clearly. This much for today. I will be bringing next video. Until then, goodbye.